right, welcome to quarter two. Um, in this quarter, we're dealing with unit two, which is called clinical care. So you're going to assume the role of different medical professionals working through the schedule of patients in a family care clinic. Over the course of the unit, you're going to explore medical careers, practice professional communication, gain experience collecting, recording, and interpreting data, learn how to perform routine medical tests, and you're going to evaluate the results. While meeting with patients, the interconnectedness between body systems is reinforced. So, how those body systems work together for your body. You're also going to explore various causes and inheritance of disease. You're going to be exposed to cutting edge technologies that are revolutionizing healthcare and will evaluate their impacts. So, the first part of our unit is called Lesson 2.1, which is talk to your doc. So think about, different ways you talk to your doctor or how your doctor talks to you. So with this particular activity, which is 2.1.1, building a medical history, our learning goals are to develop the skills necessary to communicate effectively and respectfully in a clinical setting. Discuss the importance of maintaining empathy while working with patients. Record a comprehensive medical history for fictional patient. Apply listening skills and interpret verbal and nonverbal behaviors to enhance communication with patients. So our lesson plan is at the Total Care Clinic, students see patient cases that highlight key clinical skills and explore biological and physiological content. You're going to explore effective questioning and through a role-playing activity, conduct an interview to document medical history quickly and efficiently, while also showing care and clinical empathy. Students are introduced to documentation of medical history and electronic health records. And the link is already there for you in Canvas. So if you click here, it's going to open up in Canvas, and it's called 2.1.1 Building a Medical History. So what I decided to do for quarter two is I provided the notes for you. So all of this area here where it's talking about terms and notes and all of that stuff, that has already been provided for you in a document. And again, it's on that Pear Deck, and I'll post that Pear Deck with this video. All right, so for the agenda, when you open the Pear Deck, you're going to see the warm-up. And that question is, when you go to the doctor's office, what are some careers you see? So think about different career fields that you see at the doctor's office, like when you go. We're also working with 2.1.1. So with the synchronous portion in class, we're doing those steps 4 through 6 on Canvas. The cards are provided here for you for that, and I'll go further in detail about that in a moment. You also have that SEL link, so you're going to find your block and you're going to do that SEL. Then you also have a check for understanding, which is on the next slide. Asynchronously on your own, you're going to work on the notes that I already provided for you, and you can work on some of that stuff that you didn't finish synchronously. So again, that check for understanding, when you go to slide 5, it's here. You click on it. If you can't remember out the notes, you can also click here, and those notes are also provided for you. So going back to what you're supposed to be doing in class. So when you open up that course, and it talks to you about it, so what you're doing is you're going to be in the mindset of you're actually a primary care physician. So that's what you're going in as. So you have your schedule for the day, and these are all the patients that you have to see throughout the day. When it talks about guiding questions, those are questions that you would try to get to come up with a diagnosis for somebody or why they're there for their visit. So think about questions that doctors ask you and that you would ask somebody if you were an actual doctor. Because what you're supposed to be doing is you're going to be acting like you're doing a 4-minute mock interview. And this interview is where you're going to be the role of the doctor, and then you're going to switch to the role of the patient. So if you're not currently in class, obviously you don't have a partner, so you can do this at home with somebody else. So what you would do is you would think of some questions, some guiding questions, kind of get the information that you would need from that patient. So for example, when you go back to that Pear Deck, it says cards. So when you click cards, it's going to open up. And what it has different patients. You're only going to choose 2 different patients. So think about some medical history key targets. So you've been suffering from a sore throat. With this patient 1, you live alone in an apartment complex across the street from a factory. So as your doctor role, what are some questions you would kind of ask to figure out what's wrong with a person? And then if you were the patient, what are some little key nuggets that you would give to the doctor so that they could help with your diagnosis? So that's what you're doing with that role playing. So you're going to be the doctor on one end, and then on the other end, you're going to be the patient. And like I said, you're only choosing two of these patients if you're not currently in class. Then after you do that, with the synchronous portion, again, you have that SEL, so you're going to click on that SEL. Make sure you go to whatever block you're in, and you're going to do that SEL for today. And then you have a check for understanding. Your check for understanding is a quiz, and it's 3 questions that you're going to answer. And then that is pretty much it for today. So just making sure that you understand, like, what are some, again, with the doctor, your goal is to ask the most important questions to get the patient to reveal as many key targets as possible from their medical history card. During their conversation, record the medical history information in your notebook. So as you're asking those questions and the patient is giving you information, you're kind of documenting it and writing it down. As the patient, your goal is to use the fictional medical history information on the card to answer the doctor's questions to the best of your ability. Your medical history card contains a list of key targets, which can be any type of information about the patient, such as a place of residence or past surgeries. During the conversation, check off the key targets on your medical history card when that information is discovered by the doctor. So it's almost like you're playing a game of Clue almost. So the doctor is asking these questions, you're responding based off things that you see on your medical card, and when the doctor is, getting that information correct, you're kind of like checking it off, like, okay, they understood what I was trying to say, or they got that information. So that's pretty much just all you're doing. That's what we did in class. Again, just paying attention to that synchronous and asynchronous portion. You're not doing the notes synchronously, you're doing that asynchronously on your own. And that's it.